Welcome to the Love Letters to Our Bodies podcast. I'm your host, Gwen Mitchell, founder and CEO of Moyo Institute and lifelong spiritual seeker and energy worker. Here for thoughtful conversations about health, healing, and happiness by, for, and about Black and African American women. Disclaimer, the Love Letters to Our Bodies podcast does not provide medical advice. The opinions, experiences, and insights shared are for informational purposes only. Nothing shared in this podcast is intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other healthcare provider. Don't disregard or delay seeking it because of what you've heard on this podcast. Thank you. Are you ready? Let's dive in. Hello, Love Letters family. Welcome to an episode of Love Letters to Our Bodies. Today, we have the special privilege of having an opportunity to talk with Ricki Fairley, CEO and co-founder of Touch Black Breast Cancer Alliance. As a triple-negative cancer survivor and thriver, Ricki's personal purpose, passion, mission, ministry, and blessing is to bring focus, attention, research, science, and action to eradicating Black breast cancer and supporting and coaching what she calls her blessties through their breast cancer experience. Ricki is an award-winning, seasoned marketing veteran that has transformed her strategic acumen into breast cancer advocacy. The Black Breast Cancer Alliance addresses a unique and special disease state with the overall goal of reducing the mortality rate for Black women. Ricki founded and serves as co-host as The Doctor Is In, a weekly live breast cancer advocacy web series on the blackdoctor.org Facebook page that reaches over 3 million viewers. She is a founding member of hashtag Black Data Matters in partnership with Citizen, the Center for Healthcare Innovation, and Morehouse School of Medicine. And let me just say, Ricki, that's the first time I found you when I saw that hashtag Black Data Matters. Yes. The purpose of that advocacy web series is to encourage and elevate the importance of Black women participating in clinical trial research. In January 2022, they started the When We Trial movement to change the game of Black women participating in clinical trials and to improve the outcomes for Black women with breast cancer. The movement has resulted in over 32,000 Black women in clinical trial portals in the past year. And that's quite incredible. I heard you on a recent meeting, I think with a Baltimore group last week, and I heard 32,000 women had signed up for clinical trials. And that's astounding.
Well, yeah, and it's actually 32,000 have entered our portal to search for a trial. So I have to correct you there, but so we can't really tell how many have actually signed up for a trial, but we know we've sent them to search and we try to help them find them. So our messaging is working, you know what I mean? To try to explain how a clinical trial works and what's involved and to take the fear out of it.
Absolutely. And when I heard that number, it just brought to mind the seriousness of this disease as it affects the Black community. And the fact that there were even 32,000 women looking for clinical trials, that was incredible.
Yeah, we need more, not enough, It's a big number, but we need more. We know now so much about the science of Black women and breast cancer, and our breast cancer is different. And the drugs and treatments that we have were not created for our bodies. And so it's really cool to participate.
Yes, I'd like to hear more about that. But before we go into the actual findings that you have now, let's talk about what inspired you to co-found Touch, the Black Breast Cancer Alliance.
I co-founded the organization because I thought I should be dead. And I know God left me here to do this work. So I was diagnosed with stage 3A triple negative breast cancer, which is the worst one. Black women get it at 3 times the rate of white women. And we now know our science is different. It's the most aggressive. It has the highest mortality rate and the least treatment options. I had a double mastectomy. I did a lot of aggressive chemo. I did radiation. My doctor said, okay, you're fine. Come back for a scan in a couple of months. I came back. It was almost the exact date of my first diagnosis. They found 5 spots on my chest wall. And my doctor said, okay, Ricki, you are now metastatic. You have 2 years to live. Get your affairs in order. And so I said, I can't
Wow.
right now. I have a daughter at Dartmouth. I have a daughter in college. She's a sophomore. I got to get my kids through school. So what are we going to do? I need some drugs or something or whatever. And I fought for myself. And I was able to find a doctor who put me on a clinical trial. And I did a lot more chemo in the trial. And I didn't die. It's been 14 years.
Wow,
So
that's
this is
incredible.
my God job. I know God left me here to do this work. And as I became an advocate in breast cancer, I started looking around and I said, why are Black women dying? Why are we getting it younger? What's wrong with this picture? And I started digging into the science to figure it out. And I had one of my good oncologist friends, Black oncologists, help me dig into the research on the drugs that we have. And there were no Black women in the clinical trials for the studies of the drugs that are standard of care. And so I said, we need more science. And so I really felt like not enough attention was being given to Black women. And so I said, we got to figure it out. We need more science. And so that's what made me start Touch, to really advance the science.
Well, you were really fortunate, and you're right. God loves you.
I'm
And
blessed.
so,
I'm so blessed. I'm so blessed. Thank you, God, every day. I feel blessed every day.
and you're blessing so many others with your presence and with your work and with your passion. So thank you very much for what you're doing every day.
Thank you. I wouldn't know what else to do, you know? So, so I know this is my purpose. It's so clear.
Beautiful, beautiful. So Black women face significantly higher mortality rates from breast cancer despite lower incidence rates. What are the primary factors driving this disparity?
You know, we have a 40% higher mortality rate than white women. We have a 70% higher relative risk of death than white women. We are 39% more likely to have a recurrence than white women. We get triple negative breast cancer at 3 times the rate of white women. Black women under the age of 35 get breast cancer at twice the rate of white women. So they do have higher incidence and die at 3 times the rate. But we now know that from a biological perspective, our cells are different. So if you look at the biology of a cell, if you look at a cell under a microscope, and I can show you one, they look totally different. And the drugs that we have were made for white cells. And our participation rate in clinical trials has been 3% or less in the history of breast cancer. And that will continue until we participate in the science. And so we're now have a lot of burgeoning science to validate that our cancer is different. It's different on a genetic basis, on a genomic basis, which is really the biology of a cancer cell. The environments are different. And people kind of easily want to blame it on the social determinants of health, like access to care and all those factors, our weight, our diet, all those things can affect in our lifestyle, can affect breast cancer, and all those factors play a role. So one of the things that we're participating in is a research study to understand all the interactions or intertwinings of those dynamics and how they impact our biology and our differences between white people. But it's different. We have a different disease, and that has not been treated. We're treating our disease with white drugs.
I'd like to very much see those slides of the 2 different ways that it shows up, because I
Can you let
think,
me share?
sure.
So this is a picture of a Black triple negative breast cancer cell next to a white one. Can you see that?
Yes, I can see it.
So the kind of blue one over here to the left is the node of a Black woman with triple negative breast cancer. And the other side is a white woman with triple negative breast cancer. It's a cell. So do they look anything alike?
Nothing alike.
Right.
Wow.
And so the medicines are being made for the one on the right. So why are Black women dying? And so we have a different disease. We're getting it in crazy numbers. We're getting it younger. Actually, 40% of triple negative breast cancer patients are under the age of 40. And so we have a different disease, and that's what's killing us. And that's what's making us have different outcomes.
Those images really tell the whole story, or at least it tells a part of the story.
A part of the story. Yeah, clearly there's a lot of things going on, but the science is the foundation, right? If you think about it, we can fix access to care. We can fix kind of the social determinants of health. Those are all fixable things with money or with that, different doctors and stuff. But we have to also fix the science. We have to get the right drugs.
Absolutely. And some of the science that has been done about the impact of stress on the body shows that chronic stress, impacts health and lifespan. And I wouldn't be surprised if it also affects cellular response.
It does. I really believe that stress caused my breast cancer to a large degree. It was one of the most stressful times of my life. But we know that stress creates inflammation, and inflammation can lead to cancer. And if you look at that cell closely, and I'm not a scientist, I can't really explain it too well, but basically there's more inflammation in the black cell. And so it's harder to treat the cell with the drugs. A lot to do with the inflammation. And that definitely is, anxiety does not help you heal.
Yes, absolutely.
Yeah.
When you just shared that information about all of the factors, including the social determinants of health, it becomes very, very clear why this is a different disease and why the data shows such different outcomes. So how does the SAMBAI research initiative, SAMBAI?
SAMBAI is a Cancer Grand Challenge research study. So the Cancer Grand Challenge studies, it's a global study. There are 5 funded every 2 years. It's partially funded by NIH, only not this year because they're in a mess, and the Cancer Research of the UK, which is a totally charitable organization. So they're kind of similar to NIH in terms of what they fund, but it's all based on personal funding, individuals giving money to this organization. They award 5 grants, $25 million every 2 years. And so our investigator, Dr. Melissa Davis, is a brainiac genomicist at Morehouse School of Medicine, and she is the first Black woman to get this award.
Yes.
And it's also one of the first times they've actually funded a disparity study to this extent, that this global extent. It's also the first time they've had a patient advocate like me be part of a PI, an investigator in the study. And so they basically are funding patient advocates to be part of the study. So we partner with all the researchers to help them bring the patient voice. And there are 5 kind of work areas in the study. One of them is the social determinants of health. One of them is the genetics. One of them is the genomics, which is the biology of a cancer cell. And one of them is exposomics, which is the environment. Like if you live in a place where the water's bad, like people in Flint, Michigan are probably going to get cancer, right? So we're studying all of those factors. And then I'm the 5th work package, the patient voice. And so I have a team of advocates now, a global team, and we basically sit in on the meetings with those scientists to help bring the patient voice to reality.
Incredible. That's wonderful.
Yeah, so we're doing this, as I said, in the US, the UK, in Ghana, Nigeria, South Africa, Ethiopia, Kenya, and Zambia.
That's great. That's great. I interviewed a sister some time ago from Africa, and she was saying that she was dealing with another form of cancer, and she talked about how difficult it was because of the taboo of speaking about cervical cancer, for instance.
Cervical cancer is huge. It's sort of getting a little bit better under control because of the vaccine. But it's rampant, and they don't talk about it because your husband will leave you, because the village will shun you, because you can't go back home, because they think and they instantly think you're going to die. Like cancer equals death, as opposed to cancer equals treatment and survival. You know what I mean? Because they don't have a lot of options. They don't have a lot of chemo options. And, a lot of the time it's just surgery that they do, especially with breast cancer. And so women do die more readily than they need to.
Is the SAMBAI study focusing on simply breast cancer? Or?
No, we're looking at breast cancer, prostate cancer, and pancreatic.
Okay. Wonderful. Yeah. I'm really, really happy to hear that this work is going on. The Love Letters to Our Bodies podcast is sponsored by Moyo Institute Incorporated, a nonprofit organization offering heart-centered educational experiences, and the Lloyd Symington Foundation, which supports visionary grassroots cancer programs. So you launched When We Trial to change the perceptions about Black women participating in clinical trials. What are the biggest barriers preventing Black women from participating, and how are you addressing them?
So to build When We Trial, I did a research study. I did a study of 300 Black blesties. We did a quant study, and we did 15 focus groups across the country to ask that very question. Why don't you participate? And we found 2 major factors. First one, doctors don't invite us. illicit bias, racism, whatever it is, they don't invite us. So if your doctor doesn't invite you or tell you about it, how would you know? Second reason, and equally as important, is I heard, I think I'm going to get a sugar pill and die.
Yeah.
So it instantly told me that people don't know how a clinical trial works, especially for cancer, right? And they have these preconceived notions of like being a guinea pig or whatever, Henry Lex, but they just don't understand it. But how would they? How would anybody know? How would you know how a clinical trial works? You didn't learn it in school. No one talks to you about it. And if your doctor doesn't bring it up, how would you know? And so I learned that I had to figure out how to explain what standard of care is. Because in cancer research, there is no sugar pill. You get standard of care. You get the best drug on the market or something better or different. And so I try to break down what does that mean in words people can spell from a voice of trust. And so I explain it like this, like the standard of care means you get the ice cream, you get the chocolate syrup, the whipped cream, and the nuts. In a clinical trial, you get the ice cream, the chocolate syrup, the whipped cream, the nuts, and a cherry on top.
Oh, beautiful.
On top, right? So when I start to break it down, or that Advil you took last week, it was in a clinical trial. That heart medicine I gave my dog Harper, it was in a clinical trial. And when you break it down in easy to understand concepts in terms of words, sign me up. I don't want to die. And so we built When We Trial around that premise. And we pulled together a bunch of women, blesties, and had them tell their story. So on our website, whenwetrial.org, we have a video gallery of a bunch of women, blesties, talking about the importance of trials and how it saved their lives. And so we launched the campaign, and it's really an education platform. We've gotten a lot of support, and we've kind of embellished it a little bit every year. So like last year, we reached out to cancer centers. We've reached out to doctors and other support groups. And then this year, our emphasis is going to be on pastors. So we're basically developing a toolkit for pastors because so many Black women will go straight to their pastor and tell them they have cancer even before they tell their families, right? So our campaign is called After You Pray, What Do You Say? And it's a tool
for
pastors to understand how to explain clinical trials to their congregation and then send them to us.
I love that. I love that. After you pray, what do you say?
For the pastor, right? So we try to just keep educating and educating. And so we now have garnered 32,000 Black women into our portals searching for a trial.
Beautiful, beautiful. Thank you so much. And for all that ingenuity and creativity and the ways in which you're reaching out to everyone to be included in this valuable information. Thank you for that.
Sure. We like to say we do about 100 events across the country every year because even though we're online, we have lots of social media. I try to be in the community and my team and my daughter and I. So I like to say we go where Black women live, work, play, pray, and slay. So we go to all the community events. We big event at Martha's Vineyard when all the bougie Black people are there. We're all over the place, really trying to just be in people's faces, talking to them, going to them to explain the science.
Mm-hmm. Beautiful. And I think probably one of the benefits for your presence out there in the community is it's just bringing more awareness overall to the issue, and for women to know, even younger women to know that this is something that they need to take serious. So
yeah, we have a campaign called For the Love of My Girls. Our website is loveofmygirls, spelled GURLS.org. And it's really to educate young women. We don't talk about cancer necessarily. We talk about breast health, Black breast health. So if Black breast cancer is a different thing, Black breast health is a different thing. So how do you take care of yourself? How do you know you're normal? And how do you know your her story? Because, we keep these secrets, and the secrets that Black families keep are killing us. We got to put the words out there. We try to make generational health a kitchen table conversation. And we have a lot of tools on our website to help you build your her story so you can have these conversations with your grandma and your auntie and your kids and the men in your family to understand the impact of cancer on families. Because there are a lot of connections.
Beautiful. Can you describe the Touch Care, your 24/7 Black woman survivor-led nurse navigation program?
Yeah, so we launched this a couple of years ago to help pharma get more Black women and keep more Black women into clinical trials. And so we now work with pharmaceutical companies to help them recruit Black women using a lot of our tools and our partnerships and our social media. And then when they come into the trial, we have a nurse navigation team. They are 24/7. So when the cancer center closes at 5:00, you don't have to worry. You can talk to us any time of day or night. They're all Black women and they're all breast cancer survivors. So we have nurse navigators and social workers, but they have walked the walk so they can talk the talk. They can hold your hand, provide emotional support, and help you through a trial. So we started doing it with trials. And then during the month of October, we partner on another foundation called Unite for Her, and they provide integrative care services. So during October, we get together, we kind of marry our services together, and we provide navigation and integrative care for 6 months. The first year that we did it, we had 100 women in the program. And then last October we did it, we had 200 women in the program. We actually presented a poster at the San Antonio Breast Cancer Conference about the results because they were so favorable that basically 85% of women said they wouldn't have been able to make it through the month without these services.
I interviewed Melissa Christie from Unite for Her.
Oh, did you, Melissa?
I did. And we are particularly interested in this because in our Love Letters to Our Bodies workshop, we really focus on integrative healthcare.
Okay. And they're phenomenal. United for Her is a great organization. We love them. I feel like Sue Weldon is my wife, one of my wives. But I mean, she's one of my, we partner with her a lot. And we do believe the complements of our services really make a difference in people's lives.
Absolutely.
So we try to do that. But we're partnering with probably 6 pharmaceutical companies right now providing that service for clinical trials, specific clinical trials.
And your co-founder, Valerie.
So Valerie is our navigator. She will be a 27-year survivor of breast cancer at the end of the month, and she's a 44-year nurse. So she's my co-founder. I couldn't have done this without her. She's my partner in crime. You know, we are attached at the hip, and we talk every day to how we can do this better. And she is a gift from God and my sister in this work, but she is our navigation guru. She actually trained under Harold Friedman, who is the godfather of navigation. You know, he started navigation in Harlem.
Yes.
He's 92 now, almost 93, and he's a jewel, but she trained under him. So she knew it from the very beginning of what navigation means and what it looks like, and she totally believes in it, and it's the best.
Beautiful, beautiful. Yeah. Yes, I was sitting last year on the Citizens Advisory Committee for a local group here, Black Ladies Advocating for Cancer Care, as a part of a Stanford research study.
Awesome.
Creating a peer navigation model for California as a research possibility for California women who are going through breast cancer to be supported through that entire journey locally.
That's great. We work with a great navigator at Alameda Hospital. Our name is Lynette Harper. She's a phenomenal navigator. Are you in Northern California or LA?
Yeah, in the Bay Area. So
okay, well, that's she. She's in the Bay Area. That's right, because you said Stanford, of course. And so also one of our docs that's on our medical advisory board, and she actually does a web series with Haley, with my daughter, is Candace Thompson. She came out of Stanford. She did her residency there, and now she's at Stanford in their Emeryville office.
Beautiful, beautiful. I'll reach out to both of them.
Yeah, breast surgeons. Yeah, they're awesome. She's a breast surgeon. They're awesome. I'll actually be out there for the Rise Up conference that Dr. Laura Esserman does in a couple of weeks speaking.
Oh, fantastic.
Yeah, have you heard of the Rise Up conference?
I've seen the announcements. I'll try to make a point to be there.
Yeah. Zia Jonette speaking there too with me.
Oh, wonderful, wonderful. Yeah. You are all over the map. I feel extremely fortunate because I know how busy you are, that you've taken this opportunity, this time out of your schedule to be with us. And I really appreciate that.
Sure. You're where Black women live, work, play, pray, and slay. I got to be.
Slay. Love it. Love it. Yes. So Touch has created the Black triple negative breast cancer sanctuary as the only comprehensive resource hub for Black and Afro-Latina patients with triple negative breast cancer. Why was this specific resource so urgently needed? I
love all of my blesties, but I have a very close place in my heart for TNBC because I had it. And we worked actually with one of our funders, Gilead, who's in the Bay Area, as a part of a triple negative breast cancer cohort to figure out how we can help Black women deal with triple negative breast cancer. We get it at 3 times the rate, right? And now we have science to understand why. And this was a few years ago. And so we were probably one of maybe about 25 other breast cancer organizations, advocacy groups. And we all came together and said, gosh, what do we need? We need a hub. We need a home. We need a sanctuary. And that wasn't the word. We came up with that word. So we were selected by Gilead to build this website. And so we partnered with the Triple Negative Breast Cancer Foundation, Nueva Vida, which is a Latina organization in the DC, Baltimore area, and then AACR, the Cancer Research Organization, to make sure that our data was correct. and we built a home for Black women with triple negative breast cancer. And so we spent a lot of time trying to pull everything that we knew, pull episodes of my web series, we had all kinds of videos of doctors talking about triple negative so that someone who's newly diagnosed can go there and find everything and have like the Wikipedia of triple negative breast cancer for Black women. And that's what it's all about. We're about to start working on 2.0. It's been in the market now for a year and a half. And so we've had a lot of information happen in just the last 6 months in the triple negative space. We have a lot of clinical trial results coming out and probably a new standard of care coming out any minute now. And so we will stay on top of that and update all the information so that people know what to have and what to do.
Beautiful, beautiful. Tell me, triple negative breast cancer disproportionately affects young Black women and has a particularly poor prognosis. So what do you want women to understand about this aggressive subtype?
That there's hope. It's not a death sentence. And that we now have 6 really, really very good clinical trial options for metastatic triple negative breast cancer. We have even more so for early stage triple negative breast cancer. It's the first time in the history of the disease that we've had this much trial activity. We only have 2 targeted therapies right now that have been approved by the FDA, and only one of them is for early stage triple negative. It's called Keytruda. It's a drug that's used for a bunch of different cancers. And then Trodelvy is approved for metastatic. But now we have actually one of the main clinical trials that's probably going to change the standard of care is a combination of Keytruda and Trodelvy in one drug. That's being developed right now. We just got results from that trial that are really good. We have another drug called Dashway that's also in trial. And so there's so many drugs in trial. If you have triple negative breast cancer, the best science you can have right now is to get on a clinical trial because that's the best drugs we have. And we'll get on a trial. We'll help you find them. We actually are supporting several of them with our navigation. So happy to help with that. The science is advancing pretty quickly. Thank God. For years, there was nothing. When I had triple negative, I just took regular chemo that was for any breast cancer and didn't work for me. So the drug I took on trial is now a standard of care drug, but the stuff that's coming out now is way better even than that. I mean, Black women get it at 3 times the rate, and 40% of all patients with TNBC are under 40. It's a young disease. Okay. Also, one more horrible factor is that if you do have metastatic triple negative breast cancer, which often happens to Black women, you're automatically diagnosed metastatic, only 20% of them get a progression to make it to another drug.
So knowing early and taking action early is really, really important.
Yeah, early detection is critical.
So the doctor's in another one of your landmark programs, signature programs, milestone achieving programs, has reached over 3 million viewers weekly. Yeah. And what topics resonate most with your audience, and how has the platform changed conversations about Black breast health?
We started The Doctor Is In at the beginning of COVID. And it really started because my co-host, Monique Gary, she's a breast surgical oncologist. We were on the phone one day saying, gosh, people don't want to get their chemo. They don't want to go to the hospital. They don't want to go to the doctor. They don't want to get their treatment. We have to stop it. And so we did a Facebook Live on my Ricki Facebook just to try it. And we had about 800 views. And we're like, wow, this is crazy. So my good friend, Reggie Ware, founded blackdoctor.org. And I had known him for years, kind of in my marketing background. And so I showed it to him. He's like, well, let's make a show about it. So we were actually Black Doctor's first disease content programming on the network. And so we were getting huge numbers during COVID because people had nothing to do. So the 3 million number is actually kind of our annual number, but we get about 5,000 viewers every week, every Wednesday at 6 p.m. Eastern. We talk about anything and everything. It's a girlfriend hookup. I hope it's like people are sitting in my kitchen with me at the table and we break down the science. Monique brings the science and we talk about, like last night, we had a great doctor, Ken Pienta, on from Johns Hopkins, who was doing a study to study diagnosing cancer from your hair. You don't need a blood test. You can just take some pieces of your hair. So we talk about everything. A couple weeks ago, we talked about, can faith and fear live in the same house? And I had a bunch of pastors on. On Martin Luther King Week, I had on 9 little girls who were daughters of either survivors or their mom or their grandma to talk about what does Martin Luther King mean to you? And how's that affecting how you talk to your mom about science or your grandma? So I never know what's going to happen. I meet people every day. Can you be on my show? And so we just keep making it happen. It'll be 6 years, April 1st. And we keep having these conversations. And I never, they're not rehearsed. They're just all like real talk. And that's what we do.
It's incredible. It's really, really incredible. You are definitely a woman on fire and on mission, on purpose. So let's go to the Pink Table Talk.
Yeah. Pink Table Talk, that came out of our Love of My Girls campaign. And it came, my daughter and Emily, who are our writer, said, we need to do something for young women. And so it's for young women who aren't sick, and they talk about Black breast health. And that's the essence of our Love of My Girls campaign. An offshoot of that also is we have an HBCU internship program. Our interns kind of manage our TikTok, which I don't even know what's on the TikTok, but they just show me the videos. But Pink Table Talk gets about the same kind of audience. It's a monthly show on the last Sunday of the month, and we get about 5,000 viewers. And Candace Thompson, our doctor at Stanford, is Haley's co-host. And they talk about genealogy. They talk about knowing your her story. They talk about knowing your body. They talk about genetics, family history, anything. But basically, take cancer out of the picture and talk about breast health. Does that make sense?
Yes, absolutely. Absolutely. Looking forward, what gives you hope in this work? What victories or transformations have you witnessed that fuel your continued commitment?
Research. People like Melissa Davis, people who are on the forefront of looking at the research and looking at it differently. One of my favorite quotes is Albert Einstein: a problem cannot be solved within which the framework it was created. And so we're always going to flip it over, turn it upside down. And I feel like she has taken some of the best researchers in the various areas that we're looking at, genetics, genomics, exosomics, and they're flipping it over and flipping it backwards and turning it upside down to see what's wrong, to see what's different, because cancer research has been happening for years. And the more you get into it, the more complicated you see that it is. But at some point, we have enough brains on this stuff to figure this out. And she's going to be the one to do it. I mean, I think, and she's building a team around her to help make that happen. But we're only going to change the game with research and science and Black people participating in science. We cannot emphasize that enough. I've done about 8 clinical trials. There's all kinds of clinical trials. If you want to try one, email me. I'll find you one for different things besides disease. I've done one on stress. I've done one on the chemicals on my body, in my body. So if you can participate in any science, do it with your body. And that's what's going to give us hope. I have 4 granddaughters. I have a 5th grandbaby on the way. We don't know if she's a girl or not, but I don't want them to talk about cancer. I want it to be gone.
So the final thing I'd like to ask you as we close out today is, how do you personally practice self-care and maintain your own wellness while doing this demanding advocacy work?
I paddleboard as much as I can. I live at the beach. I live in the Chesapeake Bay. Right now, it's frozen solid, so I will not be ice skating on the bay. But I walk a lot with my dog. I travel a lot for work. So when I travel, I try to explore something different. Since I'm in a different place, I'm going to Nigeria this week. And I play with my grandchildren. I try to be the nanny to my 3 oldest grandchildren on Mondays if I'm in town. And my job with my new 4-month-old grandbaby is to spend every other Friday night with her.
Beautiful.
She sleeps over. So I spend time with my kids, my grandkids. But you got to find peace. My peace is non-negotiable. And I will not drive in traffic. I will not put myself in a stressful situation. The flight's going to be delayed. I just go home and take another flight. I mean, my peace is non-negotiable, and I live by that. And so is yours. Don't wait till you get cancer to learn that.
Thank you so much, Ricki. It's been a real pleasure having you with us today. And I'm sure our listeners will enjoy what you've had to share as much as I have. Thank you so much.
Thank you. So great to know you.
That's a wrap. Thank you so much for listening to Love Letters to Our Bodies, conversations on health, healing, and happiness. To find out more about the Love Letters to Our Bodies project, visit our website at moyoinstitute.org. That's MOYO Institute.org. Follow us on social media and subscribe to the podcast so you don't miss an episode. If there are topics you'd like for us to discuss, let us know. Remember, your body is beautiful, girlfriend. Love it.